told we need answers. For today's coronavirus contradiction series, we want to bring in Dr. Ashish Jha, the director of the Harvard Global Health Institute. Dr. Jha, we are told to trust the experts, but the messaging from experts has changed so much. Why now are doctors convinced that wearing a mask is the right move?
So thank you for having me on. I'd like to sort of think of it a little differently. This is a new virus, new disease, and we are learning. And as new evidence comes in, you want your doctors to update their opinion. You don't want somebody to stick to an opinion from February when all the evidence in April and May has suggested something else. I'll tell you, back in February, March, I didn't know that, and I didn't necessarily think masks were going to be that helpful. This is an unusual disease, and now we have very strong evidence that masks are helpful. So if your goal is, hey, don't update the recommendation based on new evidence, then people can be consistent. Consistency is not what we're going for here. We're going for what's the latest evidence, what's the latest science,
right.
And Dr. Fauci has been right on this.
Right. It's also good to note to have a second opinion, too, from a doctor when you're seeking medical advice. What I'm just having such a hard time understanding it is why was it so different? Why did doctors who use masks when they're operating and conducting surgeries wear masks and not think, hey, maybe this would have helped earlier on in the pandemic?
I'll tell you why. So in the previous SARS outbreak in 2003, one of the things that we learned with that SARS virus was that it primarily was transmitted when people had symptoms. And so the idea that when you're asymptomatic, you could be spreading, we didn't really appreciate that in February and March because that's not how the first SARS virus acted. And so we assumed, barring new evidence, that that's how the second SARS virus, this one, would act. It turns out this virus acts very differently. Now, if there's somebody who knew this one was going to act very, very differently. They're smarter than I am, but none of us really appreciated that 50% of the transmission was going to be from asymptomatic people back in February and March. And so that's the issue of why our recommendations have changed, is we've learned a whole set of new things about this virus, and we've updated the recommendations.
Okay. And again, we were going based on information that was coming from the WHO, which was getting information from China. And clearly, we've learned that not all of that information has been very transparent from the beginning. So it is interesting to go based on the information that you learn over time. Of course, the recommendation now being for everyone to wear a mask when you're unable to socially distance from one another. We've learned in California that Governor Gavin Newsom has announced a rollback in reopenings for certain counties, shutting down bars, indoor dining, gyms, places of worship as these coronavirus cases surge. But we recall California was praised earlier on for slowing the spread. Now they're backtracking here. If the death rate is going down, and it is, why is this rollback happening now?
Yeah, I'm sorry. Death rate is not going down in California. It's going up in about 2/3 of the country. It is going down in New York and New Jersey and Massachusetts. So the death rate is up in the country overall.
But based on the cases that are being diagnosed right now.
Yeah, the death
You're
rates
telling
are
me
going
that the death rate is going up based on the hundreds of thousands of cases?
Well, what I'm saying is the number of people dying is going up. Number of people dying is going up. In California, in Arizona. It's been going on for a couple of weeks. I mean, there's very clear data, unless you think all the hospitals in the country are lying. Yeah, no, the number of people dying is going up in all of these states, has been for about 2 weeks. And California, I think, and I've been very critical of the way they've handled things in the last few weeks, their cases started rising, their hospitalizations started rising, and I don't think they acted aggressively enough. And so it's good to see Gavin Newsom step up and do the things. Here's another thing we have learned we didn't know 2 months ago. We've learned that being outdoors is relatively safe, and being indoors is relatively risky. And so if we're going to get through the pandemic, we want to use the latest science and evidence. And the latest evidence is we should not have people congregating indoors, if at all possible. And that's what I think Gavin Newsom is responding to now. And I think that's a good thing.
Yes. So shutting down, again, those indoor dining opportunities, these indoor places of worship, and clearly also shutting down the schools as well. That was a big decision that came out of LA and San Diego. Do you believe that that was the right move to call right now, again, for schools that would be reopening in August?
You know, I am heartbroken about schools being closed. I think we got to try to keep schools open. If I were advising the LA and San Diego, I get why they close it because their outbreaks are pretty bad. Mm-hmm. Personally, I would really shut things down for 4 to 6 weeks, see if you can bring it all under control, and then maybe delay opening into September or or late September. I think we've got to get serious about opening schools, and the way we are acting as a country, 2/3 of the country is not going to be able to have schools this fall, and I think that's a travesty. And we've got to make opening schools a priority, and I don't understand why policymakers aren't doing that.
Would you feel comfortable sending your child to school?
I'm actually, a conversation I had with my wife 2 days ago, literally at the kitchen table. We're in Massachusetts. Our case numbers are very, very low. And I'm still waiting for the plan from the school, but assuming that it's a pretty reasonable plan, I absolutely expect to send my kids back to public school this fall.
Okay. I think that's reassuring for a lot of parents to hear as well. Of course, now we're waiting on these school districts to make the final call. Dr. Ashish Jha, director of the Harvard Global Health Institute, thank you for joining us. We appreciate it.
Thank you. My pleasure. Thanks.
You got